Hey guys, welcome back to my channel. My name is aoyetoran. Today's video, we're going to be doing a couple of Uworld questions together. We're going to be answering them together, and I will take you guys through how I use Uworld to optimize my scores on the board exams. Everyone knows that in order to do well on the USMLEs or the MCCQE, if you're in Canada, it's very important to know and understand how to use such a valuable resource such as Uworld in order to succeed on the board exams. And that's why I'm doing today's video. So we are going to be doing a couple of questions together. As you can see, I am in a block of 40. I normally do a block of 40 when I do my questions. Most times, sometimes if I'm a bit lazy or I feel like 40 is too daunting, I do 20. So we're going to be going through everything together, which means that this is raw, this is not planned questions, these are random questions. So that means that I might get some wrong, but we'll learn together. There are just some tips and tricks that are important to learn in order to utilize Uworld to its fullest potential. And that's what I'll be sharing with you guys today. All right, so we're just going to go right ahead into it. I'm currently on this page because I don't want my time to keep running while I was explaining. All right, so we're going to go ahead. The first thing I do when I approach a URL question is I look at the last line. So for example, in this one, it says long-term ECG monitoring is most likely to show which of the following immediately preceding and during the syncopal episode. So sometimes from the last line of the URL question, you're able to answer the question. And so you're able to save time. For example, I believe it was question 8 that I did. Yeah, one of the questions that I did before, which said, which of the following is the best approach to this patient's ECG findings? So from this last line, I know, okay, I can look at the ECG and should be able to answer the question. So this EKG or ECG, for example, is showing me 300 beats, 150, 170. So the heart rate here is about 60. That's normal. It's in sinus rhythm, but I'm seeing that the PR interval is increased. It should be about 5 boxes, and this one is spanning a little bit more than that. And looking at the other ones, it's all increased. So it's not elongating, it's just consistent PR interval, and that lets me know that this is a type 1 heart block. So I was able to answer the question directly. Observation. I didn't even have to read the entire question. So that saves me time. Okay, so unfortunately with this question, I'm not able to answer it directly from the last line. So we're going to have to figure it out. All right, so if I can't answer it from the last line, the next thing I do is I quickly look through the options just to see how the examiner wants me to think. So the first option in this case is atrial fibrillation. So this is, with the ECG, I can tell this is a cardiac question, some sort of arrhythmia that this patient is in. Atrial fib, bradycardia and sinus arrest, sinus tachy, third degree AV block, ventricular tachycardia. All right, so let's read the entire question. This woman is young, she's 21, she has syncope, she's had recurrent episodes, so that's something important. I'm going to highlight that. The first episode happened while she was having blood drawn for a test, so looking like it's something to do with pain. Okay, she was having blood drawn for a test. Passed out several times while standing. The syncope is typically preceded by a feeling of warmth, lightheadedness, diaphoresis, and nausea, which is very important to know because if you're thinking of differentials at this point in time, I am thinking of differentials at this point in time. These are pre-syncope symptoms, which is leaning me more towards vasovagal syncope as a diagnosis, but let's keep on going. During one episode, the patient had a minor head injury and facial laceration. Her medical history is otherwise insignificant. She takes no medications, no illicit drugs. Her blood pressure is normal. It's normal, supine, and it's normal after standing, so she's not orthostatic. Pulse is normal and regular. ECG is normal. And so we're saying long-term ECG would show what? It's not AFib. This is not AFib because if atrial fibrillation will cause syncope, then it's just you won't have the pre-syncope symptoms. Bradycardia and sinus arrest. It could be because it's vasovagal. So I'm going to leave that for now. Sinus tachycardia. Third degree AV block. I don't think that's what it is. Ventricular tachycardia. No. So vasovagal symptoms is too much parasympathetic action. So that will cause the heart rate to decrease. So I'm going to go ahead and pick bradycardia and sinus arrest. Yes, okay. So now that we've gone through that question together, what I do after getting the question right or wrong, if I get the question right, then I usually look at the answer that I picked and then the answer that was most close that almost confused me. And those are my main things. I want to make sure I look through the explanation for differentiating those two. And then I read through this really quickly, this part right here really quickly. So vasovagal and situational syncope caused by pain, anxiety, emotional stress. Yes, I knew all that. Prodrome. Remember I was telling you guys that. Rapid recovery of consciousness, mainly based on clinical history of event. Oh, this is new. I did not know that. Upright tilt table testing, sometimes indicated. So if there's something new that I didn't know and it's important, then I write it down in my notes. Vasovagal syncope diagnosed with upright tilt testing in certain situations. Abrupt parasympathetic activation leads to cardio-inhibitory response that manifests as bradycardia with sinus arrest. So, okay, decreased sympathetic drive. All right, that's cool. So then I'm going to look at the one that almost confused me, sinus tachycardia. I know, I knew this, but I was just thinking, I don't know what I was thinking. Anyways, it's not worth it. But I mean, 30% of people almost picked that. So I think that's a fair point. Next question. All right, so you guys know the drill. We read the last line. What is the most likely explanation for this patient's symptoms? All right, so most likely explanation, I'm going to have to read through the entire question. But before we do that, next step is to read through the options. Acute pericarditis, aortic dissection, coronary atherosclerosis, pulmonary infarct, stress-induced cardiomyopathy, which is Takotsubo, and substance use. Okay, so let's see. This is a 34-year-old man. He comes to the emergency department. Chest pain started an hour ago. Pain is substernal pressure. Okay, so it's severe. Felt as he's young and he's having substernal pressure. So with Uworld, I'm already thinking this is a heart attack picture, right? Myocardial infarction. But he's a young man, so I'm already thinking cocaine use, or he has some sort of family history. All right, so it feels like his heart is racing, but no shortness of breath, cough, or fever. Patient's medical history is significant for appendectomy. He was seen in the emergency department 4 weeks ago for anxiety and palpitations. Okay. So anxiety could be a differential, but thinking back to our options, I didn't see anything about anxiety there, so I'm just going to take it quickly out of my head. And chest pain that resolves spontaneously. Father died at age 64, so it doesn't run in the family. Mother died of ovarian cancer. Physical exam, patient is agitated and is sweating. Blood pressure is high, so I'm really thinking it's cocaine induced at this point in time. And his pupils are dilated, so I'm thinking this is cocaine. ECG shows sinus tachy with ST elevations in the septal and anterior leads. Most likely explanation is substance use. Okay, perfect. With this question, there was nothing that really confused me. So if I'm in such a situation, then I just read through the main points and I don't bother with the options. It's very important when you're using Uworld to read through the answers because you learn from the answers. So it's not just about testing your knowledge with the questions, but also learning from the answers. Even when you get the question right, especially if you got it right by chance, make sure you read through the options. All right, guys, I hope you learned something about how to use Uworld from this short video. If you guys want me to do more questions on Uworld and go through them together, please let me know. I would love to do more videos like this, especially because I don't have to get dressed and I can just be on my desk doing Uworld questions like I normally do. Thank you so much for watching. I hope this was helpful. Please don't forget to like and subscribe if you have not. If this was helpful for you, please go ahead and share this video, as it might be helpful for someone else as well. And I hope you have a lovely rest of your day. Bye bye.